Imagine your bladder as a small balloon hidden inside your body. Every time you ignore the urge to pee, that balloon keeps stretching. But the organ people usually worry about is not the bladder. It is the kidneys. So can a simple habit like holding urine actually send danger all the way up to your kidneys? Your body does not make urine randomly. Your kidneys work all day, even when you forget they exist. They filter your blood, remove waste, balance water, and turn extra fluid into urine. That urine travels through two thin tubes called ureters and collects inside the bladder. But your bladder is not just a storage bag. It is a living muscle. It stretches, senses pressure, sends signals to your brain, and waits for the right moment to empty. At first, the signal is quiet, then it becomes stronger, and after a while, your body is no longer asking politely, it is warning you. But when you keep holding it, the urine stays inside. The bladder stretches more. Pressure rises. And a system designed to flow is forced to wait. Are your kidneys in immediate danger? Here is where the myth gets interesting. Holding your urine once in a while usually does not damage your kidneys. If you are stuck in traffic, traveling, or sitting in a meeting, your kidneys are not suddenly going to shut down because you waited longer. Your body can handle some delay. But this is where people misunderstand the answer. They hear, "Once in a while is okay," and turn it into, "Holding urine is harmless." That is not true. The danger is not usually from one moment. The danger comes from repetition. When holding urine becomes a daily habit, the bladder is pushed again and again beyond its comfortable limit, and slowly, it may stop behaving normally. Not instantly, not loudly, but quietly enough that your bathroom habits may change before you realize what happened. What about holding it while sleeping? Now here is something many people wonder about. If holding urine is risky, then what about sleeping for 7 or 8 hours without peeing? Is that also damaging your kidneys? Usually no. When you sleep, your body is not working the same way it works during the day. At night, your body naturally slows urine production so you can rest without waking up again and again. So waking up with a full bladder in the morning is usually normal. That is very different from being awake, feeling a strong urge, and repeatedly forcing yourself to ignore it. The problem is not simply that urine stayed in the bladder for some time. The problem starts when you keep fighting strong signals again and again, especially when it becomes part of your daily routine. What happens when the bladder keeps stretching? Think of a balloon. If you fill it and release it normally, it keeps its shape. But if you keep overfilling it, it starts losing its tightness. Your bladder can face a similar problem. It is supposed to stretch and empty in a controlled way, but when it keeps getting overstretched, the muscle can become weaker. The signals can become confusing. You may not feel the urge at the right time, or you may suddenly feel a strong urge when you were fine seconds ago. Some people finally pee and still feel like urine is left inside. And that leftover urine is not a small detail, because urine that does not leave properly can become the perfect place for bacteria to wait. The real hidden danger: trapped urine. Fresh urine moving out of the body helps flush bacteria away. That flushing action is one of your body's natural defenses. But when urine sits inside the bladder for too long, bacteria get more time to multiply, more time to irritate the bladder, more time to turn a normal delay into a urinary tract infection. A bladder infection may start with burning while peeing. You may feel pressure in the lower belly. Your urine may look cloudy or smell stronger. You may feel like you need to pee again and again, even when very little comes out. At this stage, the problem is usually in the lower urinary tract. But the bladder is not completely separate from the kidneys. There is a road between them. An infection can travel when a bladder problem reaches the kidneys. A bladder infection can sometimes move upward through the ureters and reach the kidneys. And once the kidneys get infected, the situation is no longer just uncomfortable. It can become serious. A kidney infection can cause fever, chills, back pain, side pain, nausea, weakness, and a sick feeling that does not feel like a normal urine problem. So, does holding urine directly damage your kidneys? Most of the time, no. But can holding urine create a chain reaction that puts your kidneys at risk? Yes, it can. You hold urine too long. The bladder overstretches. Urine may not empty properly. Bacteria get more time to grow. A bladder infection may start. And if that infection travels upward, the kidneys can become involved. That is why the danger is not always in the act itself. The danger is in what that habit can lead to. Pressure. The problem nobody talks about. There is another side of this. Pressure. When urine cannot leave the body properly, pressure can build inside the bladder. For a healthy person who delays peeing sometimes, this usually does not become a major kidney problem. But if someone already has kidney stones, prostate enlargement, nerve problems, or any blockage, holding urine can make things worse. In that situation, the bladder stays too full. Pressure may push backward toward the kidneys. And over time, that pressure can harm the urinary system. This is not simply waiting a little too long one day. This is when the body is struggling to drain urine properly, and when urine cannot flow, the whole system can suffer. The final truth. So here is the final answer. Holding your urine once in a while is usually not enough to damage your kidneys. But if holding urine becomes a regular habit, the risk starts to change. Your bladder keeps stretching beyond its comfort zone. Urine may stay inside for too long. Bacteria may get more time to grow. A bladder infection may begin. And if that infection travels upward, the kidneys can become involved. So the real danger is not that urine instantly poisons your kidneys. The real danger is pressure, infection, and incomplete emptying. Your kidneys make urine. Your bladder stores it. Your body is designed to release it at the right time. Healthy control does not mean holding urine forever, and it does not mean rushing to the bathroom every 5 minutes. It means your bladder fills, sends a signal, you respond at a reasonable time, and then it empties properly. Holding your urine occasionally is usually not a big problem, but holding it too often for too long can slowly turn a harmless delay into a bladder problem. And in some cases, that bladder problem can become a kidney problem. Your body gives you the urge for a reason. A healthy urinary system is not about how long you can hold it. It is about how well your body can fill, signal, empty, and flow.